It's 2:00 a.m. and you're awake again. The urine stream is weak, and even after you're done, your bladder still feels heavy. For men past 50, this scenario is painfully common. The name for it is an enlarged prostate, or BPH, and more than half of men in this age group deal with it. The toll isn't only missed sleep, it's the stress about road trips, long meetings, or even a simple dinner out. And there's that nagging fear that the pattern will only deteriorate with time. Here's the hopeful part. Your everyday menu, yes, down to the fruit you put on your plate, can influence how you feel. Certain fruits can subtly aggravate urinary symptoms, while others may soothe the prostate's inflammation and help you stay asleep. Here's what I'm going to do. Over the next 60 seconds, I'll point out the fruits most likely to irritate your bladder and highlight one fruit that could help you sleep better within the week. We'll count down the 4 worst fruits to limit and the 4 best to make a daily habit. When we're done, you'll get a simple 7-day checklist you can print and post on your fridge. If you want that checklist, immediately type the word checklist in the comments. I'll send you the free guide so you can begin tomorrow. A quick disclaimer. This video is educational. It is not a substitute for medical care. If you notice blood in your urine, have a fever, or experience significant pain, contact your doctor without delay. Before the full rundown, a brief note on where this comes from. The guidance here draws on reputable sources, including recommendations from the American Urological Association, reviews from the National Institutes of Health, Office of Dietary Supplements, and peer-reviewed research in journals such as the American Journal of Clinical Nutrition, Nutrients, and the Journal of Clinical Endocrinology and Metabolism. When I say a fruit may help or is associated with improved prostate well-being, I'm reflecting what those studies report. Food can be a powerful ally, but it isn't a cure. Daily dietary choices can support your prostate. They don't replace professional evaluation or treatment. And if you encounter red flags, blood in the urine, fever, or sudden difficulty passing urine, see your primary care physician or a urologist right away. 1. Fruit juices. Fruit juice has a healthy ring to it, but for men dealing with an enlarged prostate, it often ranks among the poorest choices. Here's the reason. Juicing concentrates the fruit's sugars while stripping away most of the fiber. With the brakes removed, that sugar floods your bloodstream, quickly nudging blood glucose upward and making the bladder more reactive. For those with BPH, the result is often more urgency and more wake-ups at night. 1 cup of orange juice can carry the sugar load of 2 to 3 whole oranges, and apple or grape juice can push even higher. Lacking fiber to slow absorption, the rapid surge acts like a jolt that aggravates the urinary tract. Whole fruit is the smarter path. Eat the orange rather than drinking it. Choose a whole apple and keep the skin on. If you want something crisp and cooling, go with water infused with a slice of lemon. An easy morning swap is to trade the juice glass for half a grapefruit or a small handful of berries. You still get natural sweetness, antioxidants, and meaningful fiber without the sugar dump that can intensify your symptoms. 2. Watermelon. Watermelon is cooling and hydrating, but having too much can backfire when an enlarged prostate is involved. The first problem is portion size. Large servings, such as half a plate, act like a mild diuretic, filling the bladder quickly and leading to more nighttime bathroom trips. The second problem is sugar. 1 big wedge contains over 17 grams of natural sugar, and eating multiple slices at once can spike blood glucose and fuel inflammation. For men already dealing with a weak stream, that combination tends to make symptoms worse. Aim for balance. Keep portions to about 1 cup of diced watermelon. Enjoy it earlier in the day rather than right before bed, and pair it with fiber or protein, like a small handful of nuts to slow absorption. If you want hydration without added nighttime urgency, citrus fruits are the smarter pick. They provide vitamin C, antioxidants, and steady hydration without overloading the bladder. 3. Grapes and raisins. Grapes come with natural sweetness, but that sweetness is largely fructose. A few grapes are perfectly reasonable. Polishing off a big bowl, especially later in the day, can send blood sugar up fast. Those quick rises can leave the bladder more active and heighten urgency, which is the last thing you want when nighttime trips are already a problem. Raisins raise an even bigger red flag. They're simply grapes with the water taken out, which concentrates the sugars into a small package. A mini box of raisins can contain as much sugar as a can of soda. For men dealing with an enlarged prostate, that's concentrated sugar may drive inflammation, nudge weight upward, and make urinary symptoms feel more intrusive. The fix is simple: moderation. Keep grape portions modest and pair them with a little protein. Think a slice of cheese or a handful of nuts to blunt the rapid sugar impact. Skip raisins as an everyday snack and save them for occasional use. If you want a fruit that treats your system more gently, go for berries. Blueberries or raspberries offer antioxidants, fiber, and satisfying sweetness with far less sugar, supporting your prostate instead of stressing it. 4. Canned peaches and syrup-packed fruits. Canned peaches and similar fruits stored in heavy syrup may appear wholesome, but for prostate comfort, they rank near the bottom. Here's the problem. Sitting in thick syrup means the fruit soaks up added sugars, which drive blood glucose. Surges promote weight gain and fan the flames of inflammation. In men with an enlarged prostate, more inflammation often translates to a more irritable bladder and rougher nights. Consider this: a single cup of canned peaches and syrup can top 25 grams of sugar, essentially several heaping spoonfuls from the sugar jar. Rather than supporting your body, that sweetness quietly undermines it. Smarter choices exist. Fresh peaches deliver natural sweetness without the syrup. Frozen peaches labeled "no sugar added" are easy to keep on hand and retain their nutrients. If cans are your only option, pick versions packed in water or in their own juice. Try this simple swap. Skip the ice cream crowned with syrupy peaches. Instead, slice a fresh peach into warm oatmeal or a bowl of yogurt. You keep the flavor, the fiber, and the vitamins without the sugar overload that can aggravate prostate symptoms at night. We have just covered the 4 fruits that can quietly make prostate symptoms worse: canned peaches and syrup grapes and raisins, too much watermelon, and fruit juices. Now, let's shift to the positive side, because the good news is this: certain fruits may actually protect your prostate, reduce inflammation, and support better urinary health. In this next section, we'll count down the 4 best fruits to eat every day after 50. These choices are simple, affordable, and easy to add to your regular meals. 5. Pomegranate. Few fruits rival pomegranate for prostate support. Its rich supply of polyphenols, potent antioxidants, helps quiet inflammation and shield cells from damage. In men with an enlarged prostate, greater polyphenol intake from pomegranate is associated with easier urinary comfort and a slower drift in PSA over time. Research even reports that pomegranate juice may help steady PSA following prostate treatment. Findings are mixed from study to study, but taken together, they suggest real upside when pomegranate is part of an overall healthy diet. Eating it is straightforward. Enjoy the ruby seeds called arils straight from the fruit. Scatter them over salads, fold them into yogurt, or whirl them into a smoothie. If you prefer to drink it, choose 100% pure pomegranate juice with no added sugar. Keep servings modest. About half a cup of arils, or roughly half a cup of pure juice per day, provides benefits without tipping sugar too high. If chewing seeds is uncomfortable, the juice is a practical stand, and simply dilute with water to soften the sweetness. Make pomegranate a regular guest on your table, and you add color-bright flavor and a steady stream of antioxidants that may help protect your prostate for the long haul. 6. Berries. Blueberries, strawberries, raspberries, and blackberries rank among the most prostate-friendly fruits you can choose. They supply abundant antioxidants, especially anthocyanins. These compounds neutralize free radicals, dial down inflammation, and help safeguard sensitive prostate tissue. For men with BPH, the result is less irritation and steadier urinary comfort. Another advantage is their relatively low sugar impact compared to many other fruits. That makes berries an excellent option for anyone watching weight, blood glucose, or early diabetes, all common concerns after age 50. Incorporating them is easy. Scatter blueberries over hot oatmeal. Fold sliced strawberries into plain yogurt. Blend raspberries into a smoothie. Enjoy blackberries on their own as a simple afternoon bite. Frozen berries are nutritionally comparable to fresh and are often more economical. Choose unsweetened bags to avoid hidden sugars. If chewing is difficult because of dentures or implants, blend berries into smoothies or mash them into yogurt for a softer texture. Aim for about 1 cup per day. This small, consistent habit provides antioxidants, fiber, and supportive nutrition that is gentle on the prostate. 7 citrus fruits. Oranges, lemons, limes, and grapefruits are packed with vitamin C and a range of protective antioxidants that help the prostate. Vitamin C lowers inflammatory stress and shields cells from oxidative damage. For men living with an enlarged prostate, that translates to calmer tissues and fewer irritations that can worsen urinary symptoms. Citrus also supports hydration without the heavy sugar load that often comes with bottled fruit juices. A whole orange or half a grapefruit delivers natural sweetness, fiber, and key micronutrients in a single serving. Adding citrus is straightforward. Eat an orange alongside breakfast. Squeeze fresh lemon into a glass of water. Drizzle lime juice over salads or grilled fish. If grapefruit is your preference, enjoy a modest portion as a light snack. There is one important caveat. Grapefruit can interact with some medications for the heart, blood pressure, and cholesterol. If you take these medicines, check with your physician or pharmacist before introducing grapefruit regularly. Set a goal of at least 1 daily serving. That might be 1 medium orange, half a grapefruit, or simply water brightened with fresh lemon. A smart upgrade is swapping a morning bottle of orange juice for a whole orange. You get vitamin C, antioxidants, and fiber without the sharp sugar spike. 8 tomatoes. Tomatoes are technically a fruit, and they rank among the most powerful everyday foods for supporting prostate health. The key is lycopene. Lycopene is a potent antioxidant that helps shield cells from damage and calms inflammation. In men with an enlarged prostate, higher lycopene intake is associated with better urinary comfort and a slower pace of prostate growth. Heat actually makes lycopene easier to absorb, so tomato soup, pasta sauce, and tomato-rich stews can be even more effective than eating raw slices alone. Tomatoes slide effortlessly into regular meals. Layer fresh slices into sandwiches. Spoon salsa over eggs, or fold a robust tomato sauce into whole grain pasta. When fresh tomatoes are out of season, canned options are perfectly acceptable. Choose low-sodium varieties to keep the balance right. A practical target is about half a cup of cooked tomato products per day. It is a simple, budget-friendly habit that supports your prostate while adding depth of flavor to your plate. An easy swap is to trade ketchup, which often packs extra sugar and salt, for fresh tomato slices or a homemade salsa. You keep the bright taste and the benefits without the usual downsides. We've now covered the 4 to steer clear of, and the 4 to make part of your routine. To turn that into action, use this quick checklist you can apply immediately. Fruits to limit. Canned peaches and any fruit stored in heavy syrup grapes, and especially large portions of raisins. Watermelon when eaten in big servings, particularly in the evening. Fruit juices of every kind, including those labeled 100% juice. Fruits to eat each day. Tomatoes, aim for at least half a cup of cooked tomato products, such as soup or sauce. Citrus, include 1 daily serving, like an orange, half a grapefruit, or a glass of lemon water. Berries, enjoy about 1 cup of blueberries, strawberries, or raspberries. Pomegranate, have half a cup of seeds or half a cup of pure juice. Breakfast looks like a warm bowl of oatmeal, crowned with blueberries and walnuts, alongside a glass of lemon water. For lunch, choose grilled chicken or salmon with a side salad of spinach, tomato slices, and fresh orange segments. For a midday bite, stir pomegranate seeds into plain yogurt. At dinner, serve hearty lentil tomato soup with steamed broccoli and a slice of whole grain bread. Print this checklist, stick it on the refrigerator, and tick each box every day. Small, consistent adjustments can dial down urinary symptoms and lift your overall quality of life. Picture the routine. Instead of pouring juice at sunrise, you peel an orange to eat with breakfast. Midday tomatoes and spinach find their way onto your plate. When it is time for a snack yogurt with blueberries replaces raisins. Come evening, a shower of pomegranate seeds lands on your salad. Repeating simple swaps like these can mean fewer nocturnal bathroom trips, steadier daytime energy, and a calmer mind. Men over 50 who have tried this approach often notice changes within a few weeks. One gentleman shared, "I stopped drinking juice, added berries, and for the first time in years, I almost slept through the night." You can experience gains like that as well. Here is the next step. Comment the word checklist beneath this video and tell me which is toughest to give up for you, juice raisins or watermelon. I will send a 7-day printable plan you can post on your fridge and start tomorrow. For the first 24 hours, I will personally respond to early comments with tips to make these swaps easier. So, do not miss that window for tailored help. If this video was useful, tap like and share it with someone who might benefit. Remember to subscribe and hit the bell icon, because in the next episode I will walk you through 5 drinks that may naturally support prostate health. Thank you for watching. See you in the next video.